Nice.
And that's
how
my
did you get
passion.
into this? Like,
Oh, I was sick. I had osteomyelitis. Oh, I was on antibiotics my entire childhood.
oh no.
Because I had chronic ear infections.
Yeah.
And then I got diagnosed with osteomyelitis, but they thought it was leukemia. They just didn't understand why the white blood cell count was high. And then I just had a host of cascade of problems.
Wow.
Skin problems. I wish I had a doctor like you. But they all started after about 14 years of antibiotics, pretty much every month of my life, plus intravenous antibiotics for over a year.
I know, it's killer.
So then I just had chronic IBS issues, chronic acne, skin rashes. And so I just started to do a deep dive. And then my friends were like, you should really get a degree in this because this is, you're kind of obsessed. And so I said, yeah. So then I decided to learn about nutrition. That was my interest because my mom was had a compulsive eating disorder.
Oh, wow.
So we loved food, but it could heal, it could harm. So I got a bachelor's and a master's in nutrition. I studied food as medicine all over the world. She was born in Switzerland. We lived over there for 10 years.
Wow.
And then really diving deep into the healing traditions of Switzerland, Germany, France, Greece. We were in Turkey a lot.
Wow.
And
So you refloralized your gut by naturally, I think.
Well, this has been a big topic, and I want to dive into this as well because I had to work on my gut.
Yeah.
And I knew that was the only real way to improve my skin. And then I drew some correlations, and I'm not really a professional at all like you. So that's why I'm like so curious to learn from you. But I did notice the more I worked on my gut with different types of probiotics, different types of foods, different types of, fill in the blank, it changed and got better. Wow. And I don't have scars like I used to have and, the indentations and stuff.
Regenerated. Nice.
Yeah. So that's when I first started to think about what was the correlation between my internal skin and my external skin. And I don't know, you probably know a lot more about that.
Yeah. So it's pretty crazy when you start thinking about, that what you put in your gut affects your skin, or what you put in your gut affects your mental status.
Yeah.
Like you're happy because you had a good meal and it makes you happy, right? Mm-hmm. Because that meal had the right ingredients that fed your gut, right? And it's kind of crazy that your gut creates those decisions, that the gut-brain axis is just real, that, when people are angry and they don't know why they're angry, it's because they're lacking certain microbes in their guts. Wow. And when you start seeing that on a real-time basis, looking at the microbiome, taking the history of the patient, the correlation is just like this Pandora's box that you open. And then you open the box and you're like, well, and you start asking a lot of questions, right? Well, is this bug good? Is this bug bad? Why is this bug bad in this person at this time, at this level, versus this person has the same bug and it doesn't really affect him, right? So it's a Pandora's box. But it's fascinating because as you do more, as you see more, it starts opening and it starts becoming more and more real. These bugs start like speaking to you almost.
That's fascinating.
Yeah. So that was really the beginning for me. I think the beginning, like you, I was not always an expert in the microbiome. I had experiences in my life, where I would go back and say, I wonder if my skin disorder was caused because I got those antibiotics. Now, in retrospect, I know, or, my doctor, I would be, sick with whatever, abdominal pain, and he'd give me this medication. And then I'd have worsening of symptoms or worsening of problems. Mm-hmm. And now, in retrospect, I could say, yeah, this is what happened. And same thing with even my kids, right? Raising two kids completely different, following the guidelines with one kid, and doing everything the guidelines tell you, and then, ending up with a kid that, became allergic to every antibiotic, because I was giving her antibiotics for ear infection. And then, had issues that obviously we fixed, but it took me understanding the microbiome. It took me questioning what is different between my two girls that I've done. This kid number 2, I never gave her antibiotics. I let her eat from the floor. I wasn't paying as much attention to her. You know what I mean? Yeah. It's the second kid syndrome. You're like, sure, you want to eat from the floor, fine. First kid, I was so sterile. I mean, I was cleaning it was like a laboratory.
Yeah.
My bottles were spotless. I was like cleaning her every minute. She had a little, ear infection. I'd be jumping for antibiotic, And then, at 9 years old, I realized, wait a minute, this kid is not as, as thriving. And then my little one comes along and I just ignored her. And she's thriving skin-wise, et cetera. And so looking at the two kids, how I raised them, looking back at what I did on the first one to the second one, and then realizing, I need to change the gut of my oldest one. And changing also not only the gut, but also my being a mother. I don't know if it's crazy, but it's like I was so on this kid. I was so paying attention to everything, controlling everything, controlling what career she would do, everything. And it created chaos between us. But also, what was funny is that when I started looking at her microbiome and mine, I realized how similar we were, her and I. And that's when I realized, how would I treat me? How would I want to be a parent to me?
Yeah.
And I realized that if I had to parent me, I had to give me freedom. I had to let me loose. Yeah. I had to let me shine, let me thrive. Even if things that I do are not making my mother comfortable, for example, right? Yeah. I needed to be who I am, to express my art, to express who I was. And by doing that, by realizing that, I fixed not only the relationship, but I also fixed her microbiome, because I'm sure she was anxious, as a kid, telling mom. So that anxiety kills your gut. That anxiety, gets you to be, to have, frequent, colds or whatever. So I think that was the lesson.
That's a really beautiful story.
Yeah. So.
And part of our mission is really working with mothers and daughters.
Yes.
And Penelope was 320 pounds just a few years ago. And she's lost 155.
Wow.
Yeah, and the gut has been a huge issue for us because, like you said, there was a moment where I realized I was judging her, oppressive, and I had to really let go of some of that, a lot of that, most of it. Yeah. But it's tricky because, you're enabling the food addiction.
Yes.
And she's getting deeper and deeper into her anxiety and depression, vaping, and her processed food addiction, which was even worse than I even understood. And no one really could give us advice. Even the $2,500 a month of therapy wasn't helping. And and until I decided, like you said, I need to let go, which is so scary because maybe she's going to kill herself. She's suicidal.
Yeah. A friend of mine who's in the microbiome space said to me, they're going to fall because you've been there, but you just hope that they land on soft mattresses. And that's all you have to do. You have to have faith and let go. And then a miracle happens, and then they change, and then they come back to you.
It was a miracle.
Yeah.
It was total miracle.
And you change, right? Mm-hmm. Because you're like, my mom's not on me anymore. And that's the biggest thing that I see with so many parents, by the way, because I've been that parent, right? So, and treating the microbiome is, especially with kids with autism, I see moms that are jumping from one doctor to another, to another, to another, and they don't let the body heal. They want quick remedy. They don't see. So when we do fecal transplant, right, the process of taking stools from a healthy donor to an unhealthy, and when I did the case of autism, where I took the microbiome of the sister and gave it to the brother, I started noticing changes. Like the kids started saying mama and baba within the first month.
Oh my gosh, that's exciting.
Right, and it was exciting because this was like a 19-year-old kid, never had that.
Wow, nonverbal 19-year-old.
Nonverbal 19-year-old starts saying mama, baba, and a few words. And that happened right away. But then it kind of became steady progression, right? And then we kept seeing the progression slowly. But what we discovered in the microbiome is the change was radical. He got his sister's microbiome, and he matched his sister's microbiome. So the microbes that he had that were creating that anger in his head and banging his head on the wall basically disappeared. And he matched his sisters. It's called engraftment, right? When we saw engraftment, the engraftment persisted. And it basically told us this kid's going to be fine. We just need to let this kid grow, and we need to increase his good bacteria. And we need to let him thrive. Because now we've removed the offending bug that was creating the problem. And now he's gotten a new microbiome. It's like a new garden. You got to just take care of it.
But how did it get in? I mean, was it the mom's gut-brain barrier? Was he born with it? Was it something that happened after a vaccine? Because we're seeing this mindset to me, it's problematic. This mindset of needing a quick fix for something like autism or obesity or any of the other chronic diseases that we're seeing. But why is it on the rise? And this is one of many things that are on the rise in the last 100 years.
I think it's multifactorial. I mean, I'm not one to just blame, I think everybody, feels vaccines, especially you interview these moms and they tell you, I gave the MMR to my kid and then a week later or right away my kid stopped talking, right?
That's right.
So you can't believe that moms are just crazy and not experience. Moms know their kids. Moms know what they've done, what changed. So, and we pay attention, right? I mean, like I remember with my kids, I was writing everything that I was feeding my kid, the diary, like every day, because she was like a gassy baby. Well, now in retrospect, I know why she was a gassy baby, antibiotics, etc. But, when you look at the gassiness and you record all that, and then you record, I gave my kid this vaccine, and then my kid all of a sudden changed. You have to pay attention to that. Does that mean that that's the culprit? No, I think it's probably multifactorial. I think I believe autism is either, brain primary, brain-gut connection primary, or gut connection, or genetics. So there's so many components, and I think until we kind of differentiate these causes, until we identify these causes, we're just, giving hypothesis, right, of what we believe is autism. Is autism, the mom starting off with a diluted microbiome and therefore giving less of a microbes to the kid in utero? Possibly. Are there microbes shared in the environment? Do you live in a house full of mold and therefore you're all getting some microbes, but the newborn is more susceptible because he has a diluted microbiome? Is it things like, we've overdone it with antibiotics, we've overdone it with vaccines, and this is the path we need to go into. I know it's uncomfortable for pharma, and I know it's uncomfortable for venture capitalists and businessmen and the whole industry, because the whole industry is supported by the economy of the country and the world, right?
Yes.
But unfortunately, it is a path we have to look at. Because without looking at it, we cannot understand how to fix these kids. And because if you keep pouring gasoline on a fire, it doesn't matter how much water you're pouring in to stop the fire, you're still lighting up the fire. So we have to understand what is killing the good microbes and what is allowing the bad microbes to grow. If we want to fix it.
Yeah, and so I've been taking these certificate programs on nutritional psychology, and the focus is primarily on all the studies that are coming out on the gut-brain axis. And some of these you've even created, you've participated in, or you're the leader of. And so I wondered, when Penelope was in her processed food phase, because we got blindsided. At home, we were eating whole, healthy foods, and then she was sneaking out. I mean, speak for yourself. I don't want to speak for you.
No, I was sneaking out. I'd go to 7-Eleven, and I'd go to Jack in the Box, and I'd hide it from you. I'd hide it in the closet. I'd hide it in the trash can. Then I'd force myself to vomit just to go back to the trash can and eat more. It was a sick disease.
But I do believe the processed food was altering her gut microbiome. Would you agree that that's true?
I think she probably started off with an altered gut microbiome, and therefore the processed food altered her microbiome. I think, because I see some super donors, and I know this is going to shock everyone, I see some super donors that eat the worst diet.
Really?
The worst diet.
Oh,
I mean,
my
you would
gosh.
think,
Come on.
You would think the super donors
bad.
are, pristine and they're eating, lettuce and good meat and everything, but it's actually not. But I think what happens is those people are so resilient. They have such a strong microbiome that they can eat all the junk. The problem is when you're a kid that started off with a dysbiosis, a leaky gut, you can't tolerate those foods. Those foods are poison because now you're at a deficiency.
So interesting.
Yeah, so you need to really stay away from those foods to thrive, to improve your gut.
Because she got diagnosed with dyslexia and ADHD, and they wanted to put her on medication for behavioral and all these things.
Yes.
And I said no to the meds, but that was the only thing they could offer us. And you say it's bad news, but I think it's just the best they can do. Like a doctor today, he doesn't have the business model to implement lifestyle medicine, to create an education and accountability partner for his patients. So what is he supposed to do when they come in obese? Here's Ozempic. Here's a weight loss medication, and it's an issue because we don't have viable answers because we don't believe what you're saying is true.
And here's the thing: the problem is that on both sides of the narrative, there are people like those donors that are basically eating junk food, and they're like, "Oh, processed food! I eat processed food. I'm perfectly healthy." Of course, we don't know if they're healthy because nobody's looked at their microbiome, right? But then you have the people that are like eating junk food and basically are super not healthy. So, somewhere in the middle is the truth. And I think the truth really is exactly that, your experience, which is you started off with a destroyed microbiome and you cannot eat those foods, and those food just is gasoline on your gut. So you have to remove those foods if you want to heal.
So that's why some people can eat junk food and not gain weight.
Correct.
But why do you think that we have this obesity epidemic right now then?
I think because we've destroyed our microbiome. You see it. You see it. I mean, like I see it, and here's the problem. We live in a society that is no longer outside. Think of like, even in my case, like I've gained weight during the pandemic. I'm sitting in my desk treating 50 patients a day with COVID. I'm stressed. I'm eating because I'm treating patients with COVID. I'm not going to the gym. Yeah. I'm not paying attention to what I'm eating. I'm overdoing it on the carbs. So you get into this lifestyle of stress because you have to do a job. And so the problem is then you gain the weight. It's so hard to remove and to be, to be disciplined. That's the term, discipline. And to go back and say, you know what? I'm not going to touch this. I'm not going to touch fried food. I'm not going to touch processed food. This is how I got this. But the problem is when you're stressed, think about what's happening to your microbiome. You're building up microbes. You're killing off microbes that are good for you. And you're building up bad microbes that are craving certain foods, the junk food. So you become you start developing an addiction. The addiction is really created by your microbiome.
I believe that.
When we see people that have addiction, to drugs, and then we change their microbiome. And those are obviously, I'm not going to say this happens for everyone, but certainly cases that, me and my colleagues have noticed. When you take a drug addict and you give him a completely new microbiome, they're no longer drug addicts. When you take someone that's a sugar addict, like I'll give you an example. I did a fecal transplant on a mom who basically, a grandmother who had metastatic mesothelioma. And I gave her grandson's microbiome. The day after the procedure, she started craving chicken nuggets and French fries because that's what the grandchild was addicted to. So the microbes dictate what you're eating.
And craving.
And craving.
Yeah.
So when you're a sugar addict, it's probably because you're missing microbes that are absorbing sugar. So the rest of the microbes are needing sugar, but they don't have the microbes that provides them the sugar.
I'm so grateful. This is a conclusion I've come to, but I didn't have a medical doctor to, verify it, validate it. So if Penelope can see my face, I'm just like, yay! That's what I'm not making it up. I swear.
Yeah.
Because I've been telling her this for years.
True.
So it takes discipline. Like for somebody who can't afford the fecal implant or
Correct.
isn't comfortable with that ideology.
And then we're not even there, and it's not even approved. So
right.
you can't even
true.
do that.
Right, I know it's true. That's yeah, in the United States. And so if let's say they have the discipline to stop
Yes,
eating sugar,
dis-
they're going to go
discipline.
through the withdrawals
Yes.
because the bacteria are dying
Yes,
off.
That's it.
And they're going to get headaches and body aches.
Absolutely.
That's what we hear anecdotally on our
that's
end.
that's why when you see the intermittent fasting, right? That diet works, and it is working for a lot of people. That's what I'm using right now is really intermittent fasting.
Mm-hmm.
You know, the concept that we have to eat 3 meals a day is wrong. We have to basically, so if you can drop the weight by cutting down the calories and exercising more, you're ahead of the game. But it's a discipline. It's something that you have to say, you know what, I'm going to go to the gym every day.
Yeah.
I'm going to exercise every day because I'm going to take in a meal today.
Yeah.
That's going to be 1,200 calories, you know, or
Yeah.
1,400 calories. So I need to make sure I'm in that deficit. If I want to lose weight, I need to make sure that what goes in matches what goes out. Otherwise, it's not going to happen, right?
We also believe you have to have fun.
Oh, yeah,
And it has to be delicious. If you're
Yes.
going to spend 1,400 calories, they have to be awesome.
Yes. Yes.
I was on MasterChef, so I'm really, really
Yes.
into delicious food tasting like great
Yes.
and ultra healthy.
Yes.
Because I believe it's important. But when you
Yes.
tell me that people can eat junk food and have a strong gut microbiome, I'm just like blown away.
Well,
I don't
those
want to
are
believe
resilient.
it.
Those are resilient, right? Those are the people that are really come from a diverse environment.
Yeah.
You know, you look at, they're resilient.
Yeah,
That's
like
the
in
best way to
Switzerland.
say it.
When you were born, like when you dropped your pacifier, moms never rinsed it.
Never,
They just put it
yeah.
right back in the mouth. And so, yeah,
So
it's better.
foods that are processed will just go through that gut and not do anything. Just
Amazing. So do you think your immune system is reliant on the fortified gut microbiome?
our immunity is in the gut. I mean, we're going to start showing more and more, especially starting with Bifidobacteria. Bifidobacteria is this important microbe, that group of microbes that have basically created a whole industry of probiotics. Bifidobacteria is really the beginning. Your babies are born with a lot of Bifidobacteria, but here's the thing: if they're not born with a lot of Bifidobacteria and they're lacking Bifidobacteria, if you don't intercept that problem right away, and you don't know exactly, and first of all, let's talk about, how do you test? The problem is the testing out there are not validated. So you get a test that basically is a piece of a PCR, which is like a little piece of the bacteria, and it tells you you've got Bifidobacteria, but it's only a piece. Do you have that Bifidobacteria if you're only measuring a piece, or is it a broken piece of the Bifidobacteria, or is it a dead Bifidobacteria and it's just a fragment?
So you don't know the quality, the quantity?
So you don't know the quality and the quantity.
Interesting.
And those tests, unfortunately, that we do know the quantity and the quality. That's why I'm speaking on all this, because we do whole genome sequencing, which is looking at the whole entire genome.
Amazing.
But unfortunately, that technology is very expensive. And it's not a technology that's available to the consumer yet, because unfortunately, we don't have the clinical data to back this up, to say, like right now, I have the clinical data because I'm doing the clinical trials. But it needs to be validated, verified, and reproducible. In other words, another
Amazing, yeah.
hospital somewhere
It does.
needs to do the same test and say, you know what, Dr. Hazan is right. But here's the problem. If my data is controversial, what hospital is going to go and prove that my data is real?
I think the time is now.
Yeah,
I think
I
we've
think-
been waiting for this time, and I agree with you.
100%.
You've got to have some other partners and some
Yeah.
other institutions who are willing to
Yes.
to risk it.
To risk it and say, let's look at this.
Yeah.
And I'll tell you, it's coming. You're right. Because
Yeah.
I was a keynote speaker at the American College of Cardiology
Nice.
in Georgia. And one of the heads of the cardiology department of a very reputable hospital, actually 2 reputable hospitals, came to me and said, we want to collaborate with you.
Amazing.
We want to see, in fact, one of them was a physician that was behind, a lot of drugs on lovastatin. And she said, I want to see what lovastatin does on the microbiome. I'm like, yes, perfect. I said, but be careful if it's controversial.
Yeah.
You have to say it. And she's like, we need to. And we cannot hide the truth. Listen, science is only good as science is during the time science is. You know what I mean?
I do.
It's if that scientific experiment shows to improve lives at that time, great. That was the best drug for the time. But the problem is when new advances, new technology changes, and this experiment is no longer valid and it's destroyed, well, we have to accept it.
We do, and we have
That's how we advance.
And we look at nature and how
Yes.
nature works, and there are things that go extinct, and then there's a new species that is
100%.
born. And when I think about the gut microbiome, we're literally going to the root of these issues.
100%.
What I noticed with the skin was I took every drug they could offer me, medicine, tetracycline, even Accutane,
Yeah.
and I realized it just made it worse. And that's when I started to understand it's way, way bigger than the superficial thing that Western medicine, which I tried and I trusted, and I still do for certain things, but I had to really think outside the box and actually go back to more ancient principles to understand it. And thank God for your work, because we're really going to understand
Yes.
what we need. Do you think everybody then needs a probiotic?
No, in fact, I think the answer to the gut is really the refloralization process, which is what I call it, which is bringing back the flora, but with the nutrients.
That's what I think. Okay.
I think it's a mistake that we're doing to give microbes, because you cannot monitor the level of microbes that you're giving, right? Am I overdoing it with the probiotics?
And that has to pass through the digestive system.
Correct.
So it's going from the, through that as opposed to rectally.
There's a bunch of problems with the probiotics. First of all, the majority of probiotics out there, there's a study that showed 16 out of 17 probiotics don't even have Bifidobacteria in there.
Oh my gosh.
So they're not even real, they're fake. Then the other problem is it dead or alive?
Right.
So because the bacteria, remember, is in the gut, it doesn't breathe oxygen. Now you're making these capsules, exposing them to oxygen.
Yes.
Are you killing the microbes? Number two. Number three, am I taking this pill? It's supposed to go in the stomach, through the small bowel, which is the size of a tennis court, all the way to the cecum, where it's supposed to do its action. Cecum is the beginning of the colon. And then, so did it get broken somewhere? You've heard of people that took probiotics and all of a sudden developed SIBO, right?
Right.
A lot of, bowel distension, etc.
Yeah.
So gas, bloating. And so you ask yourself, well, did that probiotic that they were taking, maybe it was a garbage probiotic. Maybe it was other microbes in there. Did it break in the small bowel? And therefore, is that what started the whole problem with accumulation of other microbes? And then the other problem is when it reaches the cecum, if it does through the stomach, did it get killed by the stomach acid?
Right. That's what I think it does.
Right.
Yeah.
Well, the majority do.
Right.
So
I mean, it's strong stuff.
yeah, and then the problem is if you create an alkaline environment and you're taking in those capsules, well, you're also taking in microbes that are not necessarily good microbes. Remember, the acidity in our stomach
Kills the microbes.
is
that are
there
negative.
to kill the microbes that, you're eating a strawberry that wasn't washed properly and 20 people touched that strawberry in the market. You're eating that, you're counting on your stomach acid to kill off those microbes. Now,
I do.
if-
I count on
yeah,
that. I do that
yeah.
all the time. I just grab a strawberry and I
Well,
eat
that's it. And we do, and it's fine for the most part, provided there's no pesticide on them. It's okay. You're getting microbes from everyone that touched it. But the bottom line is you do depend on your stomach acid, right? And so when you do depend, so that's the problem. So the next problem with probiotics is once it gets to the cecum, does it implant? In other words, do I have to keep taking these probiotics for the rest of my life? Or do they ever implant? And that's one thing that I've not seen very good studies on, showing the before and after. Sure, they show the before and after of the before you take the probiotic, after you take the probiotic, but you're still on the probiotic, so the probiotic's going to be up on the study, and you're going to pick those up. But what happens when you stop that probiotic?
Right.
Does it go back down, and therefore it didn't engraft?
I would expect it to, but
And that's what happens with the majority of them. There's very few probiotics that basically go in the gut and start implanting. Now think about when I do fecal transplant of that young girl to her brother. I basically take the stools. I have to do a lot of things to the colon to make it accept the microbes, right? But then when it's accepted, it's engrafted.
Yeah.
In other words, it's part of the microbiome. It's part of the colon. It changes the appearance. I'm testing this kid. I've tested him now for 2 years. he still matches his sister's original microbiome.
And he didn't change his diet. He didn't change
well,
anything
he
else.
changed a little bit of his diet,
Okay.
but he changed the diet before the engraftment. So that diet was started 2 years prior and is continuing into the transplant. So really it hasn't changed. But when you see that, that's engraftment. Now, I don't need to go back in there and re-implant. So think about it like a garden, right? Because that's the microbiome to me is really like gardening.
Yeah.
So you've got this field and it's full of weeds. You have to take off the weeds. You have to turn the earth, and then you have to plant the seeds, and then you have to wait for sun, light, water, and then your garden grows, right?
Yeah.
If there's a tornado, everything's going to be, disappearing.
And like an antibiotic would be a tornado.
Or an antibiotic.
Or
would
a
be-
stressful traumatic
Correct.
episode.
Correct.
Or going to the hospital having surgery.
Correct.
Those are traumatic episodes.
And there are antibiotics, by the way, that are not dangerous to the gut.
That's good to know.
Yeah, so that we're going to be coming out with that data. So that's why it's important to look at what everything does.
Yeah.
Maybe, when we talk about vaccines, before and after, maybe some of them are okay. And maybe there's one of them that is the problem, right? So
We should know.
yeah, we should know. Same thing with antibiotics. There are a few, the majority are bad for the gut. When antibiotics were discovered, it was a miracle. It was the best
It
science
was.
ever.
Yeah,
was
it
like,
saved
oh my God,
lives,
saved
extended lives. Yeah. I mean,
And
my
then
leg would have been amputated without them.
Exactly. And when you have a urinary tract infection or a meningitis, you need your antibiotics.
100%.
Right? But here's the thing. We then discovered with C. diff, Clostridium difficile bacteria you get from taking too many antibiotics, where you get diarrhea, we discovered that antibiotics are not so great because they can kill your microbiome, they can kill your diversity, and therefore you're now predisposed or prone to more diseases, right? And so then we looked at it and said, we're not going to give antibiotics as doctors. We're not going to give antibiotics to everything like a virus. We're just going to be very selective of what we're giving, right?
So you should be in the know. Like as moms, we want to
exactly.
know what we're giving our kids.
And at least you can make an informed consent that you could say, look, my kid is having a pneumonia, my kid is having a severe fever, I need to give him the antibiotic. But then I'm going to work on their guts to increase. So it's really that killing and rebuilding.
Repopulating.
Killing, rebuilding.
So I saw some research, I think it was out of Canada, that was saying that we need 30 different varieties of fiber in order to rebuild the gut microbiome. Is that data you can...
Fiber, I can definitely put, my license, my name on it. Fiber is, you can never have too little fiber. To me, it's like the bed of the microbes. They need fiber.
Oh, I really appreciate
So,
you
yeah.
verifying that.
Yeah, so fiber is definitely very needed.
And the
Just make
variety.
And the variety. Diversity
Like a
is very
pear is
important.
different than an apple, which is different than a
100%,
squash. They're all
100%.
fiber, but they all have a unique
100%.
imprint. Is that right? And so,
yes.
and different bacteria can proliferate on these
Yes.
these different types of fiber. So if you're on the iceberg lettuce diet, you might want to change it up. Have some
Yeah.
romaine. Have some
Diversity is
kale.
always good. When people come to me and they're like, I eat the same thing every day. My eggs, and then I have a salad for lunch, and I'm like, no, change it up.
Yeah.
And here's the other thing. Diversity is one thing, but also looking back at like what your ancestors ate. So like, for example, I'm more Mediterranean diet, okay? So I thrive on my yogurt. I thrive on my tzatziki. I thrive on my, on certain foods, fish and etc. I don't do so good with Mexican. I don't do so good with sushi. It's
Okay.
not my genetics. So
Yeah, right.
the what we've done in society, this idea of globalization, of globalizing everyone, where, think about the island of Kiribati, where people were used to fish and eat vegetables, and they were skinny. Now they're having foods from America, chips and Coke. They've destroyed their microbiome. Now, those are not resilient. They were on a certain diet. You've changed their diet completely. They're drinking Coke every day, which has a ton of sugar, and they're basically eating chips every day, which is horrible, okay? So now the obesity is enormous in those islands, and the majority of people are diabetic. So if you
Oh my
look at
gosh.
that model
Yeah.
of Kiribati, that island is the perfect example of how globalization occurred that destroyed the microbiome of an island. And by the way, my daughter, my oldest daughter, did some studies in Kiribati. So she's the one that woke me up to.
Did she
to
follow
the
in your
whole-
footsteps?
No, no.
Oh,
She
okay.
went. So this is
Sociology?
I wanted no music.
Oh,
I know.
interesting.
So she went. She's into the arts. So, but she was heading. But that was my thing with her is I wanted her to follow in my footsteps. But she was an artist, and I have to respect that. But it's kind of funny because I learned so much from her because she was in that island with those people. And she said to me, Mom, it's all about globalization. I had no, I wasn't even aware of the whole globalization back then. And then I looked at it and I'm like, you know what? She's right. We are globalizing the planet. When you look at Australia and you look at where they put a Costco in Australia, the people around the Costco started gaining weight. Because think about the model of Costco. It's massive consumption. You're eating a big cream cheese. Instead of those little cream cheese that you buy and that lasts you a week, now you have this mega ton and you're consuming that in a week.
Yeah.
So
I mean,
you're basically consuming those mega,
Americans have really screwed up the whole world, haven't we?
100%. I was in the Philippines and I was talking on the microbiome. And I said, what are you guys doing with McDonald's in the Philippines? Seriously, get rid of McDonald's.
Yeah.
I mean, listen, McDonald's, and I know there's a narrative on McDonald's and McDonald's needs to do better. They need to have better meat. They need to have better French fries.
Yeah, better oil.
Better oil if they want to. But right now.
Offer lettuce buns. Maybe they
That's
already
it.
do. Something
Lettuce
else.
buns would be great. So
Yeah.
yogurts. There's a place for a fast food place to be healthy.
Yeah.
And I think that's what we want. I think, looking at like RFK and all that, I think that's what he wants to
I hope so, yeah. I mean, and there's some market indicators that show that there's market share available for that. Even, Chipotle, which was Penelope's first step.
Yeah,
She
that was
went
my
from
first
BK, Burger King, to Chipotle, which was so great. And there's a new one, actually, a Mediterranean fast food. We don't have it out here.
Oh.
But it's, I think it's called Kava, and it's pretty good.
Nice.
I'm surprised, pleasantly surprised.
But I mean, we could have quality with fast food. There's no reason not to.
I agree.
I need to know what you think as a gut expert on Ozempic. Because everyone's
Yes.
talking about Ozempic. Everyone's taking Ozempic. I didn't take Ozempic on my weight loss journey at all. I didn't take any drugs, just whole
Yes,
food.
good.
So I need to know what you think about Ozempic.
So Ozempic is interesting because it sort of came on with COVID, and we knew that obesity in America is a big problem. Here's the thing. All these drugs have side effects, and ultimately it's about informed consent, right? So if you're that 300-pound person and you can't get yourself to be disciplined and you can't get yourself to the gym, and you want to take a risk on having bowel problems and motility problems and paralysis of your gut, or even long-term problems that we don't even know, that's your prerogative, right? But when you start making that the standard for everybody, I have a problem with that because then you're not telling the whole truth about it. And, I was telling you before this, when I spoke at the American College of Cardiology, one of the reps was an Ozempic rep. And I said, wouldn't it be great to look at the microbiome before and after? Now, when companies that I approach say to me, no, we're okay, we don't need to, that means they're hiding something. Because if your product is good, you'd be like, yeah, showcase my product. I have a few products that, probiotics that really believe in their products. They've seen patients call them and say, we're doing great, we're amazing. So they've actually called me and said, we want to look at what our product is. It engrafting? Is it continuing?
Yeah.
Those companies I support because I'm like, wow, they're actually interested in helping and they want to know the truth.
That's perfect. That's science.
So the rep said to me, are you a cardiologist? And I said, no, I'm actually a gastroenterologist. She's like, oh, we're not allowed to talk to gastroenterologists. And when she said that, the first thing I did is I contacted all my girlfriends on Facebook because we have a group, Ladies of the Gut. And I said, guess what? The rep of Ozempic doesn't want to talk to gastroenterologists. And then basically, so right there, I knew there's a problem and they're hiding the problem.
And the number one problem is gastrointestinal complications, and
Yes.
there's a myriad of them.
Yes,
Not
and
just-
we're actually, because, yes, people come to me on Ozempic, and here's the problem: you cannot stop those drugs. If you stop, the weight gains back.
Why is that
Why?
from your perspective?
Well, because they've created a product that basically is a needed product that you're basically addicted to. Like, I can give you small dosages of amphetamines and you're going to lose weight. Does that mean that you should be on amphetamines?
No.
No. So that's why they were off the market when we were trying. I mean, there's so many.
yeah, my mom took fen-phen, which I think is
So fen-phen.
yeah, she tried.
And how many problems did we have cardiac-wise from fen-phen?
Right.
That wasn't told. So yeah, the problem is, again, the American public doesn't want to work at being disciplined. And we need to teach them to be disciplined.
That's the biggest issue.
That's the
because
biggest
they
thing.
need support and accountability.
Yes.
They don't know who to believe. They don't know what to
Right.
believe, and the accountability isn't supported by a medical model. And that is where I see a huge opportunity in reversing chronic disease, but especially obesity.
I
and
think we need to
obesity-related diseases.
promote healthy food. We need to promote,
People cooking, getting back in the
people
kitchen,
cooking,
simple
people
things.
growing foods in their backyard.
Yes.
I mean, there's such a satisfaction. So I have like 13 beehives that I'm very proud of.
So cool.
Yeah, and I have fruit trees next to it. So I just had like this, like I had over 1,000 persimmons the other day, and I'm canning them, right? But here's the beauty: the bees have touched those persimmons, right? So it's like nature. I'm eating a piece of nature that grew in my backyard from my own hands. So, I encourage, and it's so satisfying.
That's our next step here on this land.
So satisfying,
satisfying.
to grow,
It is.
Yes.
to have a beehive, to
Yeah.
grow your fruits, to
Yeah.
make your vinegar, to make your yogurt from to go to a farm and basically get the milk from there, to know the farmer.
Yes,
to
we're all
know-
about it.
So
yeah, but
I think that's huge, and to know your farms. Like we have a bunch of amazing farms.
we do
in
right
Malibu.
here.
Yeah, and I'm like, every Saturday I'm there. I'm like, it's a joy. You know the strawberries are pure. There's no pesticide on them.
We're very lucky.
Yeah,
to
we're
be where
very,
we are.
very lucky.
Yeah, but do you also dehydrate the persimmons?
I dehydrate them, yes.
Because they're really delicious,
They're-
dehydrated.
Yes. So,
Yeah. Anyways,
and it's
I'm
natural.
so into food.
And there's so many things you can make with them. You could put some cocoa and make them as like little cupcakes. So it's a beautiful dessert.
I haven't done that before.
Yeah. So it's
A
super
friend of mine
easy.
freezes the how do you pronounce it? The ones that you have to wait till they get really soft.
Yes. So she
the-
freezes them. So you
yeah.
can make a jam with that too.
Yeah,
Yeah.
so good. I just
so
eat them.
good.
I just eat them and get them all over my face.
Yeah. But here's the thing, right? The bees, especially, I encourage anybody that has fruit trees to put a beehive next to the fruit trees.
Okay.
Because you're going to see your fruits are just going to be like amazing.
Okay.
And you're going to
This
be
is
so
essential.
healthy.
Okay, March.
From that,
Maybe
yeah.
you can help me know who.
I have
to-
I have a beekeeper.
Okay,
so
perfect.
I'll introduce you.
Thank you, because the queen. That's always been
The queen is the hard thing. That
That's
was
the
I
thing.
couldn't, and yeah, and you have to also like make sure that nobody around you, your neighbors are not spraying, because that's another thing, that nobody's spraying pesticides.
That's important.
yeah.
All right, so getting back to the gastrointestinal issues with
Yes.
Ozempic, because right now they're looking at giving Ozempic to absolutely everybody.
Big
We
mistake.
even got an offer to sell Ozempic. We are not qualified to sell Ozempic, so on and so forth. So this is the hottest thing since it's probably the newest eating disorder that we've
Yes.
ever seen.
New addiction.
And we don't know the long-term implications, like you said. But what is the impact of the paralysis?
Well, I mean, this is a problem because, if you have an ileus, if you have a paralyzed piece of bowels, it's very difficult to fix, and
So will
here's
it die?
Well, I mean, you're going to have problems. You may need surgery down the road. So there are problems that we're not even anticipating, but my colleagues are seeing that, and that's not something that's easily treatable.
That's very serious.
So it's something that you have to pay attention. And again, anything that's too good, too fast, you have to pay attention.
In fact, actually, if you were to just be disciplined, apparently you lose the exact same amount of weight in the exact amount of time, and you've built the skills
Yes.
that are required because Ozempic is stepping over the fact that they actually need to make changes to their lifestyle. And that's one of the bigger problems I see.
Yeah, well, I think this idea of over metabolizing the gut to lose the weight without doing the work, being on the treadmill or exercising, is a big mistake. You know what I mean? The body needs to work out. The body needs to exercise. So when you give it a product that's doing the exercise for you to lose the weight, that's not a good idea.
No.
Yeah.
And so apparently it's decreasing the amount of diversity in the gut microbiome.
So we're coming out with some data on that, even though they don't want to tell us. So I'm not going to discuss too much, but definitely there's an impact on the microbiome with it.
So if someone's chosen to take one of these injections or chosen one of these weight loss medications, do you recommend that they continue to fortify? Can they help themselves while they're taking the medication?
I usually recommend that if they've done it and they've lost the weight that they've wanted to lose, is to kind of wean off of it and get on a program to continue the weight loss. So if you've made that decision because you want to look good fast, right? Because we live in a superficial world where everybody needs to be, we've depicted what is health by saying the person that's like, skinny is healthy. I mean, you could see it in the magazines, you could see it on television, it's all these skinny people. That's not necessarily a healthy person. That's not necessarily a healthy microbiome to be super skinny.
Right.
But this is what society has wanted to showcase as health, right? So because of that, our kids are looking at these images. First of all, images that are touched up, right? I mean, they're not real. The majority are like touched up. So you're seeing a magazine, and now with AI, even worse. So you're seeing a magazine and you want to be like that girl on the magazine, but when you see that girl in real life, she doesn't look anything like it.
True.
So we live in a world where that's the vision of what perfection is. So all these kids are wanting to mimic that, so they go to the fast solution. So I can see in the future, a lot of kids are going to want to be on that, and then it's going to be an addictive drug for these kids. The problem is, what is it going to do long term, not only for their GI, but also possibly cardiac, possibly microbiome, possibly autoimmune issues, possibly neurological issues. I think that's what we're going to start seeing with Ozempic.
That's one of my biggest
And also
concerns.
malignancy. I think we're going to start seeing a lot of malignancy, and we're going to say, oh, well, cancer is up, and we don't know why. So, we have to start looking now, because the problem is that if you start looking at the microbiome, it kind of guides you onto what's going to happen. So with all these drugs, when you see that there's something happening to the microbiome, it tells you what that person's going to have. I mean, we're still at the science of it.
That's fascinating.
But eventually it's going to be, look, when I look at a microbiome of a person and I don't know anything about their history, and I say, are you constipated by any chance? Do you have a family history of Parkinson's? And then they say, yeah, how'd you know? Because I saw a lot of samples with Parkinson's that look like this picture. So if you begin having that signature microbiome that persists, remember, Parkinson's starts 20 years prior as constipation, right? They did studies looking back at people that they took polyps out and noticed that those polyps had a certain stain that basically was the beginning of Parkinson's.
So the nervous system.
So it starts at the microbiome level. It starts at an imbalance in the microbiome, in the microbes, that basically start the process of the disease. So you can predict what's going to happen.
So serious.
Yeah.
And when they remove the barrier of cost, then it's no holds barred.
It's right now it's all in research and we're seeing it. So we do need, funding, unfortunately. So hopefully there will be funding.
Fortunately. So like any of you who are listening.
Yes.
So
definitely.
it sounds like that's an opportunity for someone
We
to
want to
fund some
we want to
research.
see, we've seen thousands of samples. We see something in Parkinson's, that's why there's a whole big movement of fecal transplant for Parkinson's. And actually, John Hopkins, I'm working with the team at John Hopkins to raise funds for that study on fecal transplant and Parkinson's. Obviously, if we didn't see something in the microbiome in Parkinson's patients, we wouldn't say, well, let's try to do fecal transplant on Parkinson's.
Right.
My own study of Alzheimer's, right? it was a fecal transplant that I did using the wife's microbiome to the husband. And the husband remembered his daughter's date of birth by changing the microbiome.
Oh, that's so exciting.
It was the N of one that started thinking maybe Alzheimer's is a gut dysbiosis in some people, right? Because we can't generalize. Maybe in some people it's trauma of the brain, maybe it's genetics, maybe, again, the brain-gut connection. But in some people, and certainly in that patient, it reversed his Alzheimer's to where he remembered his daughter's date of birth and he was golfing and he was functional again. So we saw a signature microbiome in that patient that basically said, wait a minute, something changed. So now we can kind of say, okay, well, Alzheimer's is loss of, first of all, Alzheimer's is a loss of bifidobacteria. We just published that at the American College of Gastro. We
Congratulations.
presented it.
That's a big deal.
Yeah, so it is loss of bifidobacteria in the elderly, but elderly have loss of bifidobacteria to begin with. So why is it that some are getting Alzheimer's and some are getting cancer and some getting... So the beginning, I think, is that loss of bifidobacteria, but then there's other microbes that climb in. And if those microbes go from the gut to the brain, they could possibly be the culprit of the Alzheimer's. So then the answer would be kill that microbe, refloralize, change the microbiome to increase the gut. So when you see that, you can kind of say, okay, well, there's a signature microbiome in Alzheimer's. Can I prevent it? In other words, I see a person with loss of bifidobacteria. We've published, first of all, we showed the loss of bifidobacteria. COVID was amazing for that because it was really the opening where we saw patients with severe COVID and people that were exposed to COVID but never got COVID. The difference between the two of them were that group that never got COVID had a lot of bifidobacteria. And the group that was severe COVID had zero bifidobacteria. So that was the beginning. We said bifidobacteria must be important.
Very
it's
important.
$1 trillion industry of probiotics.
Woo!
So let's look at that, right? So then we started looking, wait a minute, the babies have a lot of bifidobacteria. The old people don't. Let's look at other diseases. Long haulers, loss of bifidobacteria. Lyme disease, which is, your chronically debilitated population.
Yes.
They have zero bifidobacteria. Crohn's disease, your inflammation, your inflammatory bowel disease, they have loss of bifidobacteria.
How about obesity? What do you think?
Obesity has loss of bifidobacteria.
So how do we build our bifidobacteria?
Okay, so wait. But
okay.
it's not only loss of bifidobacteria and
Okay.
obesity, it's loss of other microbes, which I really can't discuss right now.
Okay.
But here's the thing. So what we published is Crohn's, loss of bifidobacteria, Lyme disease, Alzheimer's, autism, loss of bifidobacteria in that population, right? So when you see a kid that is born with zero bifidobacteria and you follow that kid, most likely that kid's gonna be autistic or develop other things. Another crazy thing, diabetes, loss of bifidobacteria. So I really believe loss of bifidobacteria, so that's why my whole movement is Save the Bif. It starts the path, right? So you lose your good guys, the bad guy starts climbing in.
Yeah.
And then you have your body now, you're going to say, well, how come there's people out there that are super healthy and have zero bifidobacteria? Because there's another group of microbes that compensates for when you lose the bifidobacteria.
Oh, that's so interesting.
So the body is created to always kind of like heal itself.
Yeah.
We just as humans interfere with it.
Yes.
And we say, you know what, take this antibiotic and
Yeah.
take this antibiotic. Think about the number one reason that people with Lyme disease are not getting better. Because they're jumping one thing to another. They feel better when they're on antibiotics because you're killing the whole microbiome.
Yeah.
And you're living in a sterile environment. So you can live in a sterile environment. But here's the problem. You leave that sterile environment, you're going to get disease.
Yeah.
You stop taking what makes you sterile, you're going to get disease.
Yeah, that was my experience.
So exactly. And so when you're closed in an environment that's completely sterile, yeah, you're going to be fine, provided you stay in that bubble.
But that's like a prison.
That's a prison and that's your bubble, right? But when you expose yourself, when you get out of the bubble and you get off those pills, it's going to be a lot of work to readapt, to let your body do what it's supposed to do to heal yourself. The body has the ability to heal itself. We're just
agree.
not letting it. And we need to understand what it is. When you look at stem cells, when you look at PRP, platelet-rich plasma, what are we doing? We're taking our own platelets, spinning them, and re-injecting them.
Yes.
And they heal some people. What is that doing, right? So we have the ability to live longer with our bodies. We just need to understand how to avoid the disease, how to, extend our lives, and how to become resilient in a
Yes.
way.
Well, and I also feel like this connection to nature, like you brought up earlier in the
Yes.
conversation, is a big piece to this puzzle.
Yes.
It seems kind of silly, but going back to the basics of, being outside, being barefoot, eating food from the
Yes.
farm and things like this is so essential. It's almost like we have to re-educate people how to connect with nature, because it was taboo for my mother. I don't know about your
Right.
mother to work. It was taboo.
Right.
But our generation, we haven't really been home as much. So who's going to teach you how to cook? Who's going to teach you
Right.
where to source your
Right.
stuff? Who's going to teach you how to do that? And now we have this full re-education opportunity that's essential.
And you got to be careful stepping into the outside, especially if I'm sure you've noticed, like when you have a leaky gut, you're exposed to everything. So anything can affect you. You can get when you have an imbalance in your microbiome, which is basically unequal microbiome, loss of good microbes, increased bad microbes, anything can penetrate. A virus, a parasite. So what we're constantly doing is we're constantly killing the parasites that are entering the body because of that leaky gut, but we're not fixing the leaky gut. And that's what we need to start. Heading into the new year, next year, understanding how do we recreate the balance.
Yeah.
And so that's what needs, the research, the data, and the tools for the doctors to basically see that.
And the lifestyle medicine tools, if it is a lifestyle medicine tool, that tends to be a tricky one. We may do a Tulsi lavender tea.
I know, it's awesome.
It's probably getting kind of cold, but it's delicious.
Okay,
Yeah.
so on my journey personally,
Yes.
I have suffered from extreme constipation, and I'm like, why? I eat whole foods, I eat fiber, I move every day, I drink tons of water, and other people we have a women's group and we help women lose weight naturally. They say, I'm constipated, I'm chronically constipated, not going to the bathroom for 2 weeks, a month, 2 months, whatever it may be. Why is that when everything is perfect? You're hydrating, you're not on drugs.
But you're losing weight.
But
You're
you're
losing
losing-
1 to 2 pounds a week, up to 3.
Or maybe you're not losing weight at all and you're doing everything right.
So constipation, in my opinion, is also a gut dysbiosis. However, there are other causes of constipation, right? So is it the nerve that's not stimulating the colon anymore to move? Did you get used to certain medications that were helping you move, and therefore your body is needing those medications because you've made it lazy, right? So, for example, you hear of people that were taking a lot of laxatives, and then they can't get themselves to move their bowels. Then, there's also the diet. Most people think, first of all, bananas constipate, chocolate constipates. I don't recommend chocolate. So if you're eating the foods that are basically bulking and causing that constipation, that's not going to help you. I mean, there's even apples. Think about, we give apples for people that have diarrhea. Apples can constipate. So, the fiber, yes, could help, but it's not the high level. So this is where you're probably needing a lot more fiber. And you also probably need to see, is your colon moving properly, or is there a loss of motion because there's a nerve that's been damaged in the colon, right? And here's the other thing, is your thyroid, because we don't really talk about all that, but metabolism, is your thyroid sluggish, and therefore it's not secreting the hormone to move your bowels, right? And then, of course, there's the microbiome, where you've been used to certain foods and certain diet all along, and you've created this microbiome picture that, creates an overgrowth of certain microbes. That could be the reason for that.
Wow.
So in the future, it's going to be probably with the needs. So the interesting thing, and it's so funny because I'm leading this path with the research, and I'm seeing what's going to be in 20, 30, 100 years. But it's exciting on one hand, but then on the other hand, you're like, oh my God, we're so far from like getting this, train moving. One of the things that's amazing about the microbiome is that it's like where we were at the hemoglobin. Remember when we had blood, people were bleeding in the 15th century.
Like bloodletting.
Bloodletting. Well, remember, like George Washington was being treated for a virus.
Right, with leeches.
But by bloodletting. They drew his blood.
Yes.
They had no idea how much blood they were taking out from him and what his hemoglobin was, right? So they were just taking it out. They probably depleted his hemoglobin and gave him a heart attack, because they thought, well, that's the answer to treating a virus, right? They didn't understand about vitamin C back then, evidently. But here's the thing, right? We are right now in the microbiome space to where we were in the 1800s when we were removing blood and we had no idea what hemoglobin was. So imagine, now we know hemoglobin, if you have a hemoglobin less than 7, you need a blood transfusion, right? And now we know that if you go above 12 and 13, it's probably not a good idea. If you're at a hemoglobin of 18, you probably have hemochromatosis, right? So all these diseases came on with the beginning of looking at the hemoglobin, okay? So hemoglobin, to me, is like Bifidobacteria. Eventually, it's going to be, let's look at what your Bifidobacteria is. And let's give you this to increase your Bifidobacteria, and let's make sure we don't give you this that destroys your Bifidobacteria.
Do you need a fecal analysis in order to see what the Bifidobacteria is, or is it a blood test?
No, it's a fecal analysis.
And that's what you do at your lab.
So it's exactly, so what I said with the blood, the hemoglobin is the marker of anemia in the blood. Without that marker, we could not advance hematology. We don't have hematology. And here's the thing. With the hemoglobin, we figured out, well, the people that have a hemoglobin of less than 7 need a blood transfusion, right? But are you going to give hepatitis C? No, we figured out, wait a minute, when we're giving blood to patients that were HIV or hepatitis C, we're giving hepatitis C or HIV to those patients. So now we need to have a system where we clean up the blood first or make sure that those infected bloods do not go. So that's the same thing. So when we talk about fecal transplant, right? Now hemoglobin, that's simple. It's one marker, blood, super simple. When you look at microbes, it's a completely
Trillions, right? Like
trillions.
stars in the
And
sky.
Here's the thing. I just told you, I could see stools of a patient with Parkinson's, and I could predict that she had a family history of Parkinson's, okay? So imagine the technology needs to be there now. For me to give you stools properly, I need to make sure that I'm not giving you stools of a bipolar.
Right.
Because here's the problem. The MIT student that's donating for stools, he's getting paid $500 for stool donation. He's going to put on the questionnaire, yes, I didn't travel. Yes, I don't use drugs. No, I'm not bipolar. I'm getting paid $500, right? Does that person care? Are we, do we believe that all these MIT students are so righteous that they're going to tell the truth?
Right.
I don't think so. I think they're going to be, tempted by money. And therefore, if they're bipolar, they're still going to give the stools. The stool company has no idea what bipolar stools look like. So until we develop that technology that basically says, okay, this is what a bipolar stool looks like, this is what an autism, Alzheimer's, then we can't really give the stools. We can give it to people that are dying. Think about C. diff, you're dying, fine. People that want to try it, that are dying, that have, in my opinion, Alzheimer's, Parkinson's, it's a patient-doctor relationship.
Yeah.
It should be done between the patient and the doctor. You should know your donor. That's why my protocol is familial fecal transplant, because I feel like, well, why not take from the grandchild? Like that grandmother that I used the grandchild, it extended her life. We needed to do more. Some doctor gave her antibiotics and killed everything I did, with the fecal transplant. But here's the thing. We saw improvement. We saw her appetite improve. We saw her hemoglobin improve. We saw her cravings improve. Her life, changed,
It's exciting.
So it was exciting for that moment in time. But we need to keep seeing that. And, for me, what's safer than taking your grandchild's stools?
True.
To try it. And it should be between the patient and the doctor. Unfortunately, it's not a marketing. You can't market your family stools.
No.
Like you can't market your blood, your stem cells, your PRP.
Yeah.
But, here's the thing. At some point, that farm executive, that politician is going to become a patient. And usually they come to me because I'm outside the box, right? I
Yeah.
mean, we certainly have the Malibu clientele here
Yes.
that basically word of mouth, refers me these people. And they essentially, they see, I probably shouldn't have done this, So, I had a big executive the other day, and sadly, he lost his hearing after the COVID vaccine.
Well, I'm hearing that a lot.
Yeah, and he basically thought it was COVID, but then when I pointed out, when did you get vaccinated? He's like, a week prior to getting COVID. So I'm like, so you got the vaccine,
And you got
then
COVID.
you got COVID,
My.
and now you're blaming COVID, but really, you got the vaccine that was supposed to prevent you from COVID, right?
Yeah.
So it was a big awakening for him because
Yeah.
he's like, oh, but it's so controversial. I'm like, well, it's controversial, but I mean,
Let's just deal with
unfortunately,
reality.
this is the reality you're dealing with and why you've lost your hearing. So and here's the problem. If it was such a straightforward hearing loss from COVID, I think it's easier manageable. So I think we need to be open-minded to the problems, the consequences. We need to fess up to it.
And rise above the conflict of interest. So as the conflict of interest get weeded out of the FDA and the
Yes.
CDC and the NIH, let's say you had all the funding in the world, what would be the 3 to 5 things you would like to research and prove out undeniably?
Autism, Parkinson's, Alzheimer's, cancer. Those are my 4. Yeah.
Wow.
So autism, because I stepped into it, I feel like, I need to help these moms.
Yeah.
I mean, these moms are warriors on the front line, taking care of these kids. They don't sleep. They're
know a
worried.
lot of them, yeah.
And then what's going to happen when they die? And that's the number one thought on every parent. And they're crying every day. They speak to me because I can't do fecal transplant. My hands are tied, and it's sort of like that crazy situation I put myself in where I'm speaking
be so
and I'm out there and I'm, saying my opinion, but then I'm also in the public's eye. So I'm also being watched. So if I do something that's outside the box without the FDA watching me, then I'm in a problem. So I have to do everything by the book with the FDA watching. I had the FDA about a month ago in my office for an audit, a routine audit, they call it. And I had laryngitis that day. And my husband sent me a text and he said, please be nice. You're saving the world. Don't get angry. And I said, well, I can't get angry because I have laryngitis. And sure enough, I couldn't even say anything to her because I was so frustrated because here I am I did all these protocols on hydroxychloroquine, ivermectin. And when you talk about conflict of interest, it is hard to be that person that is not conflicted, right? It is when you have your product, when you don't want to be perceived as you want to make money, but then at the end of the day, you need money to get the boat going, to get this train going. And at the same time, I tried to be as legit as possible. Here's what I did when I started the protocols with hydroxychloroquine, Z-Pak, vitamin C, D, and zinc. I did it to kind of see, it was almost like a test from God. It was like hydroxychloroquine, H, azithromycin, A, Z, zinc, HAZ, first 3 letters of my last name. I'm like, maybe that's the answer, right? That's literally why I jumped into that protocol from Dr. Raoul, Didier Raoul in France. I was like, you know what? I'm going to patent that. That's going to be my protocol. It's going to save COVID.
Smart.
I started using it and I patented it, but I started using it on my patients. I'm like, wow, patients are surviving. But here's what happened. As I was treating patients, I realized it's only good for the severe COVID patients that are dying. Like you need to get the hydroxy in quick to kill the virus because we discovered when we discovered COVID in stools that the hydroxychloroquine kills the virus, okay? But the problem is we also discovered it kills the microbiome. And it's not so easy to fix what you've killed.
Right.
So you really have to divide your population and say, maybe hydroxy, Z-Pak, vitamin C, D, and zinc is good for the elderly that I suspect have zero bifidobacteria, the morbidly obese that I suspect have zero bifidobacteria, the diabetics. I'm going to give those drugs to kill the virus quickly. The people that are the healthy sports athletes, exercise, people, I'm going to say, you know what, just take some vitamins and boost your gut microbiome and let's see how you do, right? And that's how I saved and lost no one during the pandemic.
That's incredible.
Was really looking at that. But here's the thing. I realized I could have easily sold my patent. someone offered me $10 million for it. I did not want to, and even like, I worked with Dr. Barodi on the ivermectin doxycycline protocol, because that was another protocol that was geared more towards improving the microbiome, right? But again, not as great at eradicating the virus because it's really there to kind of boost. So if you're trying to kill the virus quickly and then, boost the bifidobacteria, you almost need the hydroxy Z-Pak and the ivermectin with vitamin C, D, and zinc, okay? So that's your worst patients. The non-severe, you go to the vitamin route, and then the moderate but healthy, you kind of go ivermectin doxycycline. But the problem is understanding that you may not have eradicated the whole vaccine. So so it became really the art of medicine, okay? So Dr. Barodi, we started a company together to house these products. And I did not want to be biased by the price that I'm getting paid. So I rejected the $10 million for my patent of hydroxychloroquine, even though it did cost me money. I also rejected Topelia, which was created initially in America. He took it to Australia. I didn't want to have any part of it.
You have a lot of integrity.
Yeah, I'm like, you know what? I don't want to be, because he started the whole movement of like, we need to raise 20 million. And then there was a whole big noise about, Dr. Barodi and 20 million and this and that. Even though, listen, that was ethical, that was righteous. He needed to raise the money to get these clinical trials into market.
Yeah.
But here's the thing. What happened is when I looked at that, I said, I don't want to be mixed in with 20 million, 10 million, even Progenibiome, by the way, someone offered me $185 million for Progenibiome. I told this to my mom. She nearly passed out because she's like, what? Like everybody I tell to, they're like, what? I'm not bought by money. I'm not, I live in Malibu. You live in Malibu. We're privileged, right? God put us in here in this amazing environment. It's paradise. I have my garden. I have my chickens. I have my, my beehives. I mean, what a privileged life, right? My way of giving back is doing exactly what I'm doing, which is understanding the microbiome to advance the science. So I cannot be biased. But at the same time, we do need funding. So that's why I created a foundation to kind of raise the money of the in 4 years that I've been working every single day and night, I've been dumping my savings into my company, into the microbiome. I could have easily sold these stool tests like everybody else.
Yes.
Microbiome testing, I published the data. But I'm strictly staying research because I want to say this is the beginning of research.
Yeah.
We need to ethically see it. I don't want to, I want others to say, you know what, Dr. Hazan is right. Because then that validates my research. If I put a price on it, then I've tainted my research. You know what I mean? And to me, the research, understanding the microbiome is way more important than money.
It is, and you have so much integrity. I have so much respect for you.
But it's my life, right? At the end of the day, money's not going to save me.
It should be its own organ.
Yeah, 100%.
And right now, if you go into if you go to your GI doctor, they're not going to say the things you're saying.
No.
They don't understand it because it's this emerging field of science.
Right.
What do you think is the thing or the top things that America needs to do to get healthy again?
I think decrease stress, number one. That means turn off your news. I think the news are antagonizing, are divisive. I think the news is just a PR, to sell products. So turn off the news. That's the first thing. Go outside, exercise. Go outside, play in your garden. Go outside on a hike. Go outside, meet a friend, hug a friend. I'm a big hugger. Like the whole pandemic, people were
scared.
When
I first saw you today, I gave you a big hug.
I'm a big hugger. I'm like, give me those Like, it's so funny because like one of my
give me those microbes.
One of my employees, I test everyone in my office on their microbiome, and one of my employees has severe migraines, and I kept telling her to test herself. And then she basically had 0 bifidobacteria. And she comes in and gives me a hug. I'm like, I don't know if I want a hug from you because you have 0 bifidobacteria. But you know what? I have some bifidobacteria, so I'm going to share and give you a hug.
That's cute. That's
cute. I think that's one. 2, grandparents need to be with their grandchildren. Get those microbes mingling to bring back the balance. You know what I mean? It's like you see people that are with families, like in families where you have like parents with their children and grandchildren, the parents live longer.
Yeah.
So you want to live longer, go back to your grandchildren, touch your grandchildren, hold your grandchildren. Happiness is not, a dollar or money. It's really the people you meet along the way, the stories you've made, the interactions. That's really what happiness is. And I think we need to be. I'm a huge humanitarian. I travel all over the world. I love people. I love different cultures. I love different races. And I realize there's no such thing as like, enemies. I really think I've come to the realization that enemies are really people that are lacking microbes and need it from you and hate you because you have them and they are lacking it.
That's a great way to describe it.
So I always joke, because people, with this world of dividing people, I always say, maybe your enemy has microbes you need, so maybe be nice to your enemy.
Right?
You know
Yeah,
what I
that's
mean?
also the art of war. I mean, it's an
That's
ancient concept, actually, but
Yeah,
we've gone
so-
far away from it.
We've gone far away, and I think we've also we have to be humble also to know that this is all, we're in this world until we figure out like how to live forever and how to cure something. We really don't know anything.
It's true, and there are a lot of people suffering out there.
Yes,
We talk to
yes.
people every day who are just so desperate, and that's why they're considering a dangerous drug like Ozempic.
Ozempic,
I look
yes.
at it as a dangerous drug because I understand how much effort and how many decades it's taken me to rebuild my gut microbiome, and to compromise it for weight loss. I understand everyone's saying that the benefits outweigh the risks, and I'm not sure I agree because we don't know
I
long term.
disagree. And I mean, I think, when you see, what you've done, the natural way and the success and also the pride in achieving that, like I've lost like 17 pounds doing it, intermittent fasting and getting back into shape and going back to the gym. I feel good about that. I don't have to, to say, oh my God, I took a drug that I'm dependent on the rest of my life. So
It's true, it builds confidence.
it builds confidence and it makes you a warrior because you're not, and here's the thing, how does America get better again? America needs to warrior up. America needs to be less victimized, less paying attention to the media that creates fear and saying, you know what, I'm going to have faith over fear. The whole pandemic for me was jumping in the abyss of the microbiome, jumping in the abyss of COVID, not knowing that I was going to survive, with the faith that God was going to catch me, that God was going to be there with me. And let me tell you, it was a struggle, like taking care of patients with oxygens of 63%, writing 3 protocols with the FDA, having the FDA in my office twice during the pandemic, So having the Department of Health from California in my office, to investigate protocols that I had with the FDA. They're like, well, why are you treating COVID? Because I'm a doctor, 1, and 2, because I have a protocol with the FDA. Why are you here?
Well, I mean, I got canceled for talking about vitamin D and zinc and vitamin C. I mean, completely. I had a huge platform.
Yes.
Not
Anything that's like natural, like, but don't go in the sun because the sun is vitamin D.
It
God
causes
forbid.
cancer.
Yes.
I always thought if the sun causes cancer, then air must cause lung cancer. If the sun causes skin cancer. Now, I know that's completely not founded in science.
That's the thing, right? They're trying to remove natural things that are healing
because they can't patent them.
because they can't patent them. So, and think about what they're doing to our cows, the milk.
Vaccinating them.
And then saying, oh, well, the cows are secreting methane. I've not seen a cow secrete methane. I mean, you would think they'd have the microbes from methane production. But, again, propaganda, again, PR to sell because, and I said that at the Senate hearing of Ron Johnson, the price of the stock during the pandemic, the price of the stock mattered more than the price of a life. And when we start doing that, unfortunately, what we're going to start seeing is karma, because karma has it that eventually you learn something.
There's a great accountant.
We're here on this planet. What I throw into the universe, what I've done during the pandemic, having survived, being on this stage of the microbiome, seeing the microbiome being opened, was really because it was all a test, right? even seeing my name, the first 3 letters of my names for a patent, that I never did anything with it because I said, you know what, this is not the right drug for everyone. And God forbid I would give it to a young person and kill their microbiome. Because I really think like the majority of diseases is we try to help, but we don't have the tools to know where do we stop in the treatment. You think of the Lyme patient. The reason they have 0 bifidobacteria, is it the Lyme that comes in and kills the bifidobacteria? Or is it that we've overkilled going after that tick to kill? You know, I was...
Good question.
And here's the other interesting thing. I was in Zimbabwe with a guide because I analyzed the microbiome of the animals on a safari. So, because I'm big, like I just quest for knowledge. So when you start utilizing money to analyze stools, money has 0 meaning, literally, because you're like, I'm putting it into, in fact, my staff is like, you're spending that much to analyze tigers, lions, and, you know, and giraffes.
Zebras,
And zebras. I'm like, yes, I am. But I learned from that, right? So what did I learn? I learned that, first of all, the microbiome of an elephant is completely different than a lion. Is that possibly why the elephant is an herbivore? And is that possibly why the lion is a carnivore? Different microbiomes? Maybe if we, you know, so that was something that I started looking at. The second thing that I noticed is the dung of an elephant has a lot of ticks in it. So my guide opened the dung in front of me, and there were ticks flying. And I said to him, I said, and then he put it back and then put it in the ground and then prepared my meal without washing his hands. And then I'm eating my meal. So to me, it's like refloralization.
Okay.
But I asked him, I said, how do you not have ticks here? He goes, oh, no, it's not a problem in Zimbabwe. So I said, can I analyze your stools? So I analyzed, not this particular guide, but I analyzed another guide's stool. And what I noticed was he had the phylum of spirochetes, which is where the Bartonella is in that phylum. And, you know, like phylum is like groups of microbes that share one thing in common. And then as you go lower, it's like the species, right?
Okay.
So what happens? Why isn't he getting Lyme disease? Because he's got the group of microbes in his gut that recognizes that tick. What have we done in America? We've sterilized so much that you can't find someone with that phylum in America.
Interesting.
So now we've diluted so much that we're down. So if you look at an African, African in Africa that has been untouched by vaccines, untouched by antibiotics, you know, they have a lot of phylums. If you look at an American person, they have 3 to 4 phylums. That's it, 3 to 4 phylum. So we've lost a lot of phylum that we needed.
It's a whole philosophy here.
So now think about it. Immunity is in the gut.
I believe that.
Immunity is you house microbes in your guts that are recognizing other microbes. So when you are exposed to those microbes, that's putting it in layman terms, okay? Because I think we complicate things in terminology. Now I'm exposed to a microbe, like I'm exposed to, I had COVID, COVID's in my gut, I've got that fingerprint, I've got one species in there that's kind of like whatever.
Yeah.
Now I'm exposed to someone with it, it's recognizing that microbe. So therefore it doesn't create an autoimmune response because it's like, hey, I'm part of the family.
Right.
That's how I see it anyways. So I could be wrong, but that's how I see immunity. It's really because you have that fingerprint of that microbe, it's not going to attack a foreign microbe. But if you don't have the fingerprint in your gut, now you're exposed to think about the person who's sterile, doesn't have any microbes in their colon, now goes outside, steps on some dirt, has a parasite, that parasite's going to go in, that virus is going to go in.
Yeah.
A pepper is going to become toxic because peppers have a lot of viruses on there.
Oh, I didn't know that.
Yeah, tomatoes have a lot of viruses on there. So there's viruses. Viruses are smaller than bacteria.
So it's not so much the nightshade as it is the viruses that live on these foods.
Yeah, there's viruses, bacteria.
Yeah.
You know, so.
And they're not bad. It's
they're
just
not bad. They're just
part of the family.
Part of the family.
Yeah.
And so the idea that like microbes are bad, Yeah, some microbes are bad if you let them, grow, but the majority of the problem is we're lacking good microbes.
Yeah, and the
We've
variety.
killed
The diversification.
we've killed the diversity, we've killed the good microbes, and that's where we get ourselves into a problem.
Yeah, and then we've stripped out the fiber.
Yeah.
And so I'm curious about this carnivore trend that we're seeing. Are you
Yes.
familiar with this high meat diet?
Yes.
What are the impacts to the gut microbiome long
We're,
term?
we're coming out with that. Nothing I can discuss right now, but kind of can discuss some. I will say that much like the lion is specific with his microbiome and is a carnivore, and much like the elephant is a herbivore and has a specific microbiome, that's the same thing in humans. I think we have different species within us that are, in different continents. If you think about the microbiome, right, and you look at these phylum thing, I always equate that to the planet, right? When you look at the planet from far and it's got all these continents, it's almost like phylum of groups of microbes, right, that share one thing in common. So you have Africa, Asia, Europe. And then as you zone in, right, you go phylum, class, order, family. It's like zoning into, the continent of Africa, and then going into Morocco, and then going into Casablanca, and then going into a street in Casablanca, and then going to the species, the people that live. So every continent has groups of microbes that share one thing in common. So our diversity in humanity is what creates humanity, right? So when you look at the Asian population, they're completely different than the Italian, completely different than the North African, than the American, but they also have different microbiome that allows them to survive in those areas, right? You think of the person in Mexico who drinks the water from Mexico and doesn't have giardia.
Right.
But then I go from California and I drink the water and I get giardia because my microbiome is not adapted.
Right.
So when you think of carnivore is great for that population that can tolerate the carnivore and has the robust microbiome to eat the carnivore.
Does it make them aggressive like a tiger?
Well, I mean, it's hard to tell. I mean, studies need to be done on that. But I think, ultimately, I think it's the microbiome is specific to what the diet is. And here's the thing. Both diets, both whether you go carnivore or vegan, have a lot of diversity within them. Like if you look at the vegetables, the vegetable diets, vegetables have a lot of diversity of microbes, right? A ton. If you look at the carnivore, they have a ton of diversity. But it's somewhere in the middle is that balance.
Well, yeah.
So
That's
but
what my
I
experience has showed me.
Yeah. So I think you need your meat for the vitamin B. You need for your ruminococcus. If you need ruminococcus to survive, you need certain products. You need your bifidobacteria. Bifidobacteria. We found helped with milk. So and certain products. So mother's milk stimulates the growth of bifidobacteria in the baby, in the newborn. So I think there's different things, different nutrients that the body needs to have a balanced microbiome.
And some people can absorb and function well on the carnivore diet. Now there's not, is what I'm hearing.
Correct. And also the carnivore itself, like are you having a piece of meat where the beef has been on antibiotics?
Oh, yeah, that's a whole
and
other topic. Yeah,
vaccinated,
sourcing.
and that's
Right,
going to
right.
kill your gut.
Yes.
I mean, when I was treating C. diff, Clostridium difficile, I was noticing a lot of kids with Clostridium difficile, and a lot of the problems were when you take the history, they were like, well, I had a hamburger yesterday and then I got C. diff. And you have to ask, did the meat get so much antibiotics in it that
Yeah.
it killed the quality
And
of the protein?
all over the world, they're doing this antibiotic thing.
Yeah.
And I get it. It's worse here, I think, because
They
when we
stopped.
go to Europe, it's different.
Yeah, they stopped the antibiotics by the FDA about 7 years ago because there was an increase in C. diff. And
That's really helpful to know.
Yeah, they stopped the antibiotics.
But
and
not vaccinating the animals.
Not vaccinating. I don't think they're there yet. I think they need to see, what it does. But, of course, when you're putting the ground has pesticides and the cow's eating grass that is pesticides on it, it's not going to help the cow either.
Right.
So, it's all a circle. And then if you're spraying, if you believe in their spraying, etc. So it's not easy what's going on in the world. We live in a toxic world.
We do.
mean, literally, and you're kind of like have to constantly
Detox.
build up your microbiome. I'll tell you a funny story because I travel all over the world, so giving lectures, and my microbiome didn't really change when I went to the Philippines and when I went to even when I went to the Zimbabwe, it didn't really change that much, which was interesting because here I was in the jungle and the ticks and all that, and it didn't change that much. But I went to Italy, and I had just like the best food. I mean, like the farms and just the best food.
Olives, the wine,
Olives. I didn't have the wine because I like to rebuild my microbiome. But although one glass of wine they say builds your bifidobacteria,
Really? Yeah,
builds your microbiome,
I
but
don't
more
drink
than
alcohol,
that.
but
Yeah, so I didn't have the wine, but I was having like the cheese and the old cheeses and the fermented food and their milk and their yogurt. And I came home and my bifidobacteria was like twice as much. Woohoo! And my diversity was like so much.
Interesting.
So I'm like, I really need to move to Italy.
That's a great excuse.
So it was like, oh my God. So, and it's so funny because they're asking for people to buy land in Italy. I'm like, but you have to live 10 years. I'm like, maybe Progenobiome should open in Italy.
Yeah, maybe.
So yeah, so I really loved it.
So you're a big fan of fermented food.
Yeah, I'm a big fan of fermented.
So are we. Do you ferment your own?
Yeah, I ferment my own. I know what I'm using. I know the salt I'm using, if I'm using salt for sauerkraut and all.
What kind of salt do you like to use?
I honestly, kosher salt.
Kosher salt.
Yeah, that's it.
And then do you have an idea about why the fermented foods will repopulate the gut and build it stronger than perhaps a probiotic that comes from a pill?
I don't. I think there's a flaw in the probiotic. Now, if you're taking a probiotic that has been tested, that you've seen, and it's the perfect probiotic, and it probably increases. The problem with the probiotic that I find is that it doesn't sustain the gut. You have to continue taking it. I hate taking pills.
Me too.
I hate taking pills.
But fermented food, I love it.
Yeah, fermented
And
food.
you get fancy with it.
And also it's like I made it, so there's I'm proud about it. I make my own yogurt, so I love all that.
Nice.
Everything that I create, there's a satisfaction to me. It's like I didn't depend on something, and I'm not big. I'm not big on foods that are basically made in cans, and because I just don't trust it.
I don't either. They have to go through a sterilization process.
Yeah, they have to
It's part of
sterilize
the health department.
Exactly. And the problem is, look, even the milk, okay? Think about when we were young.
Oh, yeah. We talk about this a lot.
No, because the milk, remember when we were young, we used to have like fresh milk.
Yes.
In our
farmer
doorstep.
deliver it. Mm-hmm.
And here's the thing. We didn't get home till 5 o'clock. So the milk was outside.
Yeah.
Yes.
From like 8 a.m. to like 5 p.m. Mm-hmm. What did it do at that point? It
Fermented.
became kind of like a kefir fermented.
Yeah. Mm-hmm.
So we were drinking kefir that was naturally occurring and we were getting fresh milk. The problem is when the milk started hitting the shelves and being bottled in
Pasteurization and homogenization.
yeah, and because it needs to stay and not go bad.
Right.
So the whole preservation of the foods
Interrupted.
is what killed the food.
Completely.
And that's the same thing with
Yeah.
the vitamins. I make my own vitamins.
That's why we have to make our own food.
You have to
we
make
have
everything.
to make our own food.
And you have to supervise. Like I make my own vitamins. I supervise them. I test them because I'm a big.
I love it.
Because
You're
listen,
my kind of gal.
No, because during the pandemic, the first thing that I was seeing like pharmacies that were vandalized. And they were going after the vitamins. And then I was seeing that whole narrative against vitamin D, vitamin C, and
Being
zinc.
shut down on Facebook and Instagram
And I'm like,
and everywhere.
wait a minute. So vitamins are essential. So what am I going to do? I'm going to go to CVS and buy a bunch of vitamins. I buy, like how everybody was buying toilet paper, I was buying vitamins. But then I decided, wait a minute, what if CVS, their vitamins has crap in it?
I have a
Let me
feeling they
test
do.
it. So I did test it, and it was crap in it. So I basically said, you know what? I need to find a pharmacist. So I called, Mickey Fine in Beverly Hills, who compounds my medications, and I'm like, I need to make my own vitamins. And then basically he told me, and I started utilizing this company. And then basically I told him, I'm like,
I need to
by
learn
the
this.
way, no,
I
I'm like,
really wanna
I
learn
basically
this.
said to him, I'm like, I'm testing your vitamins and I'm giving them to my patients. And if I find that you put crap in there, I'm going to have your head.
Yeah, there's
and
gonna be hell to pay.
the guy's like, no problem, Dr. Hazen. Don't worry. You can test all you want. We're going to be fine.
Nice.
Same thing with my bovine, by the way. So I have this bovine immunoglobulin, okay? And it's blood from the cows, okay, that they spin, and it's the clear stuff, right? But the whole
You
time.
inject it?
No, it's by mouth. It's
Okay.
a powder.
Okay.
And it's actually been amazing for a lot of my patients
To rebuild.
to rebuild the gut. So we actually, there's data coming that it shows that it increases Bifidobacteria. It decreases the Bacteroides, which is like your, the bacteria we found with anxiety.
Oh my gosh.
It increases
this is
the
revolutionary.
Yeah, and it decreases the Proteobacteria, which is the bad microbes. And it increases
Wow.
the diversity, okay? But here's the problem with that, is it's blood. Blood can have
Impurities.
viruses, bacteria, spike protein, vaccinate. I don't know what they're doing to those cows, right?
Yeah.
So we test every batch. And again, that same company, I tell them, I'm like, I'm going to test the batch. If I find that there's impurities, I'm shipping you all the batch.
Yeah.
So we had to basically, package all that, test all that, and we test every batch.
to be
we
so
test
vigilant.
everybody. Why? Because I'm giving it to my patients. I'm not going to attain success if I don't know what's in those products.
Absolutely not.
And
yeah.
here's the thing: a lot of and I have doctors who have started using the vitamins we use, and they're like, it's unbelievable. It actually works on my patients. And I was giving the same. I go, no, you weren't given the same. You didn't check the ingredients of those vitamins. You didn't check the ingredients.
It's not regulated in this country. In
It's
Germany
not
and Switzerland
regulated.
and France, other countries it's regulated, but it's not here.
But in France, they don't give the amount that we need to give. So like in France, if you want to get a vitamin D and you want a 40,000 unit, because you need 40,000 for that cancer patient, for example,
Yeah.
You can't find 40,000. You have to swallow like 20 pills.
Yes.
I don't recommend for anybody to take 40,000 units unless you're supervised by a physician and you're under a protocol of research to test something. But what I'm saying is, like, if you wanted that quantity, you can't do it over there.
Can you explain something to me?
Yeah.
Why is it that exercise is so important for a healthy gut microbiome? What is the correlation?
That's a good question. I think probably, I don't know.
Could it be the capillary density or hormonal regulation? Or it's
It could
interesting.
be all of it. It could be, it could be the circulation. It could be the, the oxygen going into the capillaries, which feed the gut. It could be so many things.
Penelope oftentimes asks me, Mom, could
And
it be?
also, it's like, there's hormones that are secreted, when you're exercising.
Yeah, maybe
So it's all that. I think it's all that.
It's just fascinating. I mean, I know it from research, reading the research, but I didn't really understand it. I couldn't create the
I think
correlations in my brain.
That would be a good study to do. I know I test the microbiome of athletes. I have a lot of,
Yeah,
NFL
you mentioned they were
players.
stronger.
Yeah, and it's interesting because they abuse their bodies like crazy. And so
Maybe it is the adversity. Maybe
yeah,
it is
so
that
it's-
resilience that
it's
you
that
get
resilience. It's
uncomfortable,
building
you
that-
build,
Yeah, I
and then you get stronger.
I think it's that resilience. It's again that worrying, being a warrior and not a victim. It's that let's strengthen the good ones and then weaken the bad ones.
I love that theme for this whole podcast episode.
Warrior.
Just stop being a victim.
Stop being a
and just
victim.
stop believing
Yeah.
everything you hear
Yeah.
and do your own research and get curious.
And here's the thing, and I said that at the beginning, a product that works doesn't need PR. A product that's helping people, word of mouth PR is the biggest PR, right? We saw it with ivermectin, right? So what I noticed on the front line with ivermectin, because I'm the one that wrote the protocol at the beginning in July that we submitted to the FDA, what I noticed when I was treating patients with hydroxy Z-Pak, and I didn't know if they were on placebo or the real drug, I basically started giving them ivermectin. One of my patients that crashed, and now I know he was on placebo, he was on his way to the hospital, and I had given him a prescription of ivermectin. And his oxygen was in the 60s, 70s. So I said to him, why don't you go get some French fries, which is basically high fat, and take all the pills, the 36 milligrams of ivermectin, okay? He was 63%. He's going to the hospital. He's dying. You know, I'm like, let's see what it does. He arrives at the hospital. His oxygen saturation is 92%, and he's breathing, and he's feeling better. So he tells the doctor, he goes, my oxygen was 63 at home. Here are the pictures. And the doctor said, whatever that doctor gave you, follow that doctor because she knows what
French
she's doing.
fries and ivermectin.
So basically what happened is I learned from that, right? So the first thing I did was like sign the alarm, right? Because there were a lot of doctors like me that didn't really just follow the narrative. They were inquisitive. They were asking questions.
They weren't all willing to be vocal, but right.
They didn't feel comfortable. Some of them were vocal, you know, Peter McCullough, Pierre Corey, all those guys were vocal. And so what happened is we started talking and we started, you know, and I was the big, you know, talker about it. I'm like, oh my God, oxygen went up. I think it's because it increases bifidobacteria by some, and you know, my friends were not into the microbiome at all. So they were like, you know, like I remember talking microbiome with Dr. Merrick, Paul Merrick, and he was like, my head hurts from everything that I told him, you know, in that short period of time that I had to educate him on everything I knew. So I was already there and I was like seeing ivermectin increases bifidobacteria. So to me, that's what was happening. So one patient, two patient, and you know, on Twitter, you saw me, I would post like the oxygen at 63%. And I was on real time too. I was like, pray for me. This patient is oxygen. You know, I had some prime ministers of some countries that were my patients that didn't want to go to the hospitals, were COVID, low oxygen. And I would post on Twitter, you know, at the time it was Twitter, I'm like, oxygen 73%, pray everyone that I keep this patient alive because he doesn't want to go to the hospital. And then I would post the next day, oxygen is up to like 90%.
Oh my gosh.
And then 5 days later, oxygen went from like 73% to 92% or 95%.
Huge wins.
And it was like picture before. It was the same ring, the same guy. You couldn't make this picture up. It was before the whole AI, you know, fake pictures.
Right.
And even my colleague, you know, Dr. Barodi in Australia, he was like, wow, that definitely tells the story. So I knew I was on the right path, and I spoke about that.
Yeah.
When I spoke about it, other patients demanded, hey, can we try ivermectin? Hey, can we try that? And they experienced it themselves.
Good.
And that's the PR, right? That's PR without speaking, right? It's basically saying, this is my thoughts, this is what happened. So when you see people talk about like something, it reinforces like, you know, what you saw. It's basically, so ivermectin, that was the most controversial drug, you know, is going to be beneficial. I don't think it's going to be the answer to all, but definitely I think utilizing it appropriately with the appropriate other drugs might be a good possibility for some cancer patients, might be a good possibility for long haulers. But again, notice saying, okay, well, I'm going to give it for this much time. Because unfortunately, ivermectin does increase. We noticed it increased the bifidobacteria within 24 hours. But we also noticed that after the 24 hours, it drops even lower.
Interesting.
So, you know, you don't want to be dependent on drugs again. You want to have a solution that basically is continuously maintaining your gut.
Yeah.
And so these are the discoveries. These are the discoveries on the front line of research. And this is why you can't stop it, because I may add this, you know, today I was talking to Dr. Robin Rose, who's like the physician with, you know, that's always on the Chris Cuomo show. And we were talking, she had her idea of the spike protein injury. I had my idea because I look at it as a microbiome.
Right.
She's looking at it on another thing. And we kind of like came to the idea together. We're like, you know, well, this is why we collaborate, right? This is why we started talking initially about, you know, treatment, because together we form a hypothesis, and somewhere in the middle is the answer. And then we find a treatment, right? Because it helps her, it helps me, it helps her with her patients, it helps me with my patients.
Yeah.
I don't know it all. I never, you know, I'm willing to, I'm open-minded.
I hear
and
that.
I'm the person that's always, look, if I'm wrong, I'm wrong. And I'll be the first one to admit it.
Yeah.
I was wrong about hydroxychloroquine at the beginning because I thought it was a great solution. But then when I saw it killed the microbiome, it wasn't such a great solution after all.
Yeah.
So, and unfortunately, you couldn't even talk about it.
I
Because
know. They've
if you
censored
talked
us
about
so
it like
heavily.
you're political. Well, I'm not political.
No.
I'm not
You
agreeing.
care about health and freedom.
And I wasn't
Yeah.
agreeing with either side of the politics.
Right,
I
yeah.
mean, one was pushing the vaccine, the
I
other one
know.
was pushing hydroxy.
I know. It's
I was like, you know what? I'm
Let's
not
just
in
help
any of
people.
those. Exactly. And I hope that my being who I am really humbles people to be open-minded because they're going to be the patients, right? When you look at people like that have a platform, like people like The View or people like that have these huge platforms, and they use their platform to drive the people towards a certain drug, and that drug is the wrong way, it's not good.
there are consequences.
There are
Major
consequences, and then the
consequences.
problem is they're liable. I mean, when you tell someone this is the answer and the answer kills you, you're liable. I don't care if you're a doctor, if you're a journalist, if you're a baker, there is a liability. And I think eventually the lawyers are going to keep up with that and are going to realize, why are we suing the doctors for telling the patient that the drug is the answer?
They're taking their license away
And
when they're
taking their
when
license.
they're asking questions about whether or not
That's
the
it.
vaccine is a good idea for this
Right.
particular patient.
And why are we suing the journalist that's on a media platform that basically is saying, you've got to be open-minded, you've got to be humble, you can't put yourself in a hole and say, this is the answer. And, I mean, I've seen so many journalists, especially with the vaccine.
Well, that's why we're talking to you about this, the obesity epidemic, and we're
Right.
talking to other doctors because
Right.
we want to understand it and we want to get to the bottom of it. And unfortunately, there's just so much we don't know.
Right.
And I remember, Penelope, when you made the change from processed food to eating more whole foods, there was a point of no return. I mean, her
Right.
taste buds changed.
Right.
Her cravings changed, but this feeling of never being satisfied didn't change for a really long time.
It takes a long time to
why is that?
change the microbiome. You've destroyed a city, you need to rebuild it. That's the best way to say it. You've destroyed a garden. You had this beautiful orchard, and it all burned to the ground. It's going to take you years to have apples again.
Yeah.
It's just the nature of it. I mean, you've removed all the microbes. Now they need to find a new bed. You've destroyed the land, the sand, the soil, right? You've destroyed the colon.
It's probably like
the
sand.
colonic mucosa. And basically, there's nowhere for good microbes to even implant. Now you've got to clean up the mucosa. You've got to implant the new microbes. And you've got to let them grow naturally and peacefully. And it's tough. It's really hard. I know, because I destroyed my own microbiome on an experiment, but it wasn't intentional. It was really like,
I love how you use yourself.
Yeah, well,
I
I
love
mean,
that.
we do, because I've done like 96 stool samples on me. Wow. So I have a lot of data on the microbiome just looking at me as an N of 1. But it took me a year and a half to rebuild.
Yeah,
my
that's about-
original Bifidobacteria.
Interesting.
And then it took me, and then what happened is, like, I was overdoing it on certain products to rebuild my Bifidobacteria, and I ignored my ruminococcus.
Interesting.
Right? Which was basically, and I ignored other microbes that are absorbing vitamin B and folate and all that. And I'm like, oh my God, I need to replenish this now. And then somewhere along the line, you realize, wait a minute, I don't need to do this to increase my Bifidobacteria, because I'm back to where I was. Now, the beauty that I have is that I had my microbiome before the pandemic. So I knew what I looked like before the whole before all the experiments I did on my microbiome during the pandemic, panicking about this, taking that, etc. So I knew what I looked like before. So to me, it was like, well, I need to be exactly kind of like this, right? And so
you had a baseline.
And I also stored my stools. So I always said,
That's fascinating.
if I have a whole freezer of my poop.
That's
because I always
fascinating.
said
Poop freezer?
I can always go back and autologous fecal transplant to me. So it was my original.
That's interesting. Kind
Yeah,
of like women
so-
save their ovaries, or
Well, that's
like
it.
you're
So
saving your bacteria.
So when there's a power out in my building, the first thing I care about is like my freezer. I'm like, get the generator on the freezer, because I'm storing that.
Fascinating. Do you think
so
that
it's my goal?
The bacteria that live in our skin are completely different bacteria than live in our gut?
No, everything that you see in your skin ends up in your gut.
Because you could also
Everything that's
test
in your
eventually that
nose,
might be less
you could-
invasive
yeah,
on
so
the
you
skin.
Could test. And by the way, nose also.
Fascinating.
Nose microbes mouth microbes. So, that's why,
Fascinating.
you don't want to kill too much in the mouth,
And then what about these colon hydrotherapies that are a little bit more
Yeah.
exclusive, but is that really taking away all the...
I worry about that because I worry that you're depleting the microbiome. Same thing with, I said about laxatives, right? When you use a lot of laxatives, you're cleaning out the microbes. You're shocking. You're evacuating all those
So it's a
microbes.
real fine edge if you're constipated to...
And here's the thing. You have to ask yourself, is the constipation a compensatory mechanism to microbes wanting to implant? In other words, when I do a fecal transplant, right, the first thing I do is I constipate people for 5 days. In other words, they can't have a bowel movement for 5 days. Why? Because I want implantation. Because if they have diarrhea, well, they're removing everything I've given them, right? I want implantation to occur. So, what am I doing when I constipate is I essentially let things settle to engraft, to implant, right? So constipation is just that. I think it's just a mechanism of, wait a minute, you have very little microbes, and I need to hold on to as many microbes as you have. And therefore, I'm not so obsessed with people's bowel movements as I am with, has it changed, right? So if a person says to me, I was constipated my whole life, and then all of a sudden I have diarrhea, that's concerning to me because what is going on in your colon? Are you growing polyps that you now are having diarrhea? Do you have a cancer lesion? Do you have something that changed your bowel movement? So if a person says to me, look, every 3 days I have a bowel movement and that's just me, then that's your normal, okay? I mean, just because somebody else has a bowel movement every day doesn't mean that's your normal. Okay. That's your fingerprint of your microbiome.
It's helpful to hear.
Yeah, so I think, we tend to be, as people, thinking that we need to have a bowel movement every day, we need to have that flat belly every day, but maybe that's not the way it was. That's not the way it is. You think of Renaissance women, they didn't have that flat belly that, that they're just curvy and healthy, and that's
Most
the way
women
it
do
is.
look like that.
Yeah, and that's it. So
Yeah.
You know.
And Penelope used to always say, are we just like responding to our bacteria? And in fact, the bacteria are driving everything.
I think so. I think we're just a reservoir for microbes.
And so it's so interesting. In the same way your hands are tied and doing the
Yes.
work that you know is effective, it's almost like what's driving this societal context of victimhood versus being a warrior is a direct reflection of what's happening in their gut microbiome.
Exactly.
And I feel like there's a point of the discipline where you feel the freedom on the other side of it, when you're free from the sugar addiction and the alcohol
Yes.
addiction and the food addiction. And there's
And the junk food addiction.
and
yes.
there's a point of no return where you
Right.
feel so amazing, you're never looking back. But
Right.
that point of no return does take some time to develop.
100%. And I think that resilience is also takes some time. So you have the point of where you're leaky gut, dysbiosed, and you're susceptible to everything. And then you have the point where you're trying to grow back those microbes and retain some kind of balance. And then you have the point of the balance. And then you have the point of the resilience, where you're so balanced that now you are strengthening the good guys. And no matter what hits you, it bounces back.
And I'm really worried about the impact of SSRIs on our
Oh,
gut
yes,
microbiome, of
100%.
statins on our gut
100%,
microbiome, of sleep
yes.
medication,
Birth
and the
control.
correlation of
Birth
schizophrenia.
control, for sure.
I mean, there's so many things that I have seen in my clients over the last 20 plus years that they've stopped
Birth
certain
control
things.
pill is interesting because it definitely changes the microbiome. And I think it's not necessarily the hormones themselves. I think it's all the extra supplements they put with the hormones. To
Interesting.
make those pills. And I think it's, again, the preservatives, the compounds they use to formulate all these products. Same with the vaccine, in my opinion, by the way. It's not necessarily, the concept of the vaccine is a good concept, where you take a piece of a microbe, you give it to a person, and basically they're no longer exposed, they're immunized. They have an immunity, right? Because now we're giving them a piece of that microbe. However, it's how that microbe, that piece of the microbe, you think about the messenger RNA, how it was created, and a plasmid, and all that, and the contamination and all that. That problem is what unfortunately creates the problem, the bigger problem, in my opinion.
Me
So
too.
that's why I think in general, the science is there on the concept, but when you apply it to human body, it's one thing to do the science on a lab rat or mouse. It is another thing to apply it on a human body, and it's another thing to apply it on the human body in general, knowing that everybody is different. I think that's a big mistake, and we need to stay away from that globalization but because again, globalization sells all over the world. The world is open now. And we need to stay away from that whole globalization. We need to preserve each microbiome. So if I had a wish list for Christmas, it would be to basically have a fund where we can start testing the microbiome of different regions of the planet and preserve that microbiome signature of different regions, so that, if something happens to a race, we can correct it rather than having it go extinct. Because here's the big problem
powerful.
that I see is if you remove one race, I think you remove the diversity of the overall planet, and then you remove humanity. The microbiome is very simple, right? You have a group of microbes, a lot of phylum, and basically you have different species, and it creates this whole environment network where everybody's doing everything, right? You remove the Clostridium, you're removing the function of the Clostridium. You remove the E. coli, you remove the function of the E. coli. You remove the ruminococcus.
You're handicapping the system.
So lactobacillus, you remove that, you can no longer, so you're removing multiple functions. Pretty soon, the human, that's the reservoir, is diseased because you've removed.
And that's what we're seeing in our country.
And that's what we're seeing in America. We're the first ones to see that on a massive level. And so basically what you see is a diseased human when you remove microbes, okay? Now in the planet, when you remove continents of races or microbes of a certain region, you're essential, and you're globalizing.
Like an atomic bomb.
Yeah, and well, of course, like an atomic bomb will hit Japan, but then across the planet, on the other side in San Francisco, it will hit San Francisco, and you'll start seeing a lot more cancer in that
There's
area.
no separation.
So it's all intertwined.
Yes.
So we need to preserve different races of humanity, different regions of humanity. We cannot globalize, because then that's destruction of the planet. And if I had a magic ball or a ball to see the future, I would say that the way the planet disappears is exactly that. It basically kills off races and regions, and it's a loss of microbes. Here's something that's going to shock everybody. Bifidobacteria, which is the bacteria that we showed, loss of bifidobacteria in Alzheimer's, autism, Lyme, Crohn's, long haulers, COVID severe patients, is linked with degradation of plastic. So everybody...
Oh my gosh.
Yes.
I mean, everyone has microplastics in their
degradation.
body.
So you could take plastic, put a ton of bifidobacteria, it's going to decompose plastic, okay?
What?
Is there a problem with plastic in this world because we have loss of bifidobacteria, which is, by the way, something we're starting to test. We're starting to test the microbiome and the accumulation of plastic with bifidobacteria versus people that have high bifidobacteria that don't have microplastics in their stools.
Biofilm buildup and microplastic buildup. That's fascinating.
So if we believe in the whole climate and everything, did we destroy the microbiome so much that we are having climate problems? Because let's look at Alaska has icebergs that are melting. What have we done to Alaska and that whole area? Pollution, acid rain. Now you look at Argentina, where they don't do that much, and the iceberg is growing. Is that the balance of the planet? Is there a destruction in the northern part of the globe of bifidobacteria that is not occurring as much in the lower side?
I'm curious. I'd like to
I don't
find
know.
out.
But the fact is, if there's a loss of bifidobacteria, in humanity, there's going to be, loss of bifidobacteria in the earth. Is that bifidobacteria in the earth helping? It's so much,
I think it is.
Yeah, I
Or
think
else it
so.
would-
It's the
yeah,
balance.
it is the balance.
Even in the planet, there's a balance of microbes.
What
And
have-
so,
what have you seen alcohol do to the gut microbiome?
well, alcohol is a sterilizer, right?
Mm-hmm.
So by nature of the fact that it's a sterilizer, it would wipe out the
So
microbes.
alcoholics basically have no.
And then you wonder, is that why alcoholics are predisposed to infections? Is that why alcoholics start having liver problems? Because there's an imbalance in the microbiome of the liver too. So alcohol is not a
But
good
one glass of wine is okay.
One glass of wine they showed. I think that data needs to be reproduced very well because I don't know that they looked at the diets that these people were on at the same time. Like, were some people taking vitamins at the same time as they were drinking wine, right? So
When you
I
drink
think,
wine fresh, it's different than when it's been sterilized.
yeah, I mean, wine is a fertilizer as well. But I mean, is it? But it's also, would it kill? So.
I think, I think, I mean, I don't know. I feel terrible when I drink wine.
yeah, I
I feel
never
like I have an allergy to alcohol in general.
Yeah.
Funny enough, when I was obese, I would drink occasionally, but then when I lost weight, I've never had alcohol since.
Oh, good. Yeah.
Which is interesting.
Alcohol.
But I'm an anomaly. I mean, probably you find that at our age, when we go out, I mean,
Everybody
drinks.
drinks. But I think it's a culture, right? I mean, I think it's like,
I feel horrible. I'm not willing
Yeah,
to take the
I'm
time.
not.
I don't have the time.
I'm not. But I'll tell you, if you are drinking, vitamin E and milk thistle is really good for you.
Does vaping or cigarettes have an effect on the microbiome?
We're testing that. We have some data. We noticed some kids during the pandemic that were super sick and they were vaping. So we wonder if vaping maybe has an effect. But you have to so when you do these experiments of looking at the microbiome, you have to really kind of not change anything on the before and after, not change the diet, not change anything, and then just change that one thing.
It's tricky.
It's tricky. Yeah, it's very tricky.
I'm afraid we're out of time. We have to do this again.
I know. Okay,
It was
I have one
great
more
being
question.
here.
That was so great to have
One
you.
more question. One more. What about smoking pot? Because a lot of people smoke pot, and they say it's good for you, bad for you. But what does it do to the gut microbiome?
What do you think it does?
I don't know.
What do you think? Just guess out.
I'm gonna guess it's not good.
Yeah, it's probably not good.
'Cause you get
so
the
you
munchies.
get addicted, right?
Yes.
So is the addiction to marijuana something that you've made your body used to, and therefore you're appeasing it, right? So I've kind of talked about the vaccines and drugs, and now I don't want to get into the marijuana because then I'm going to have the cartels after me. But that's not a study.
Not funny.
No, that's not even a study I want to do or even want to publish. But I'm going to say to people, if you cannot get off a product, it means you're addicted to it. Okay, if something is making you feel so good and it's not fixing your problem and you're constantly on it, the key to life is to be healthy without needing anything but good food,
Yes.
good nutrients.
Yes.
That's it.
people.
Good people. That's it. That's the key to life. Now, if you need a marijuana to wake up, then that's probably not a good thing. If you need alcohol to wake up, that's probably not a good thing. If you need a medication to be happy, or a medication to fall asleep, or that's not a good thing. If you need a glass of wine to be perky, that's not a good thing. Anything that again, a warrior does not need anything.
No, you don't want to disrupt cycles of nature.
No,
Understand how nature works and don't disrupt the cycle.
That's it. And just zen out and get your body in check and focus on good nutrition, good nutrients. Unfortunately, you have to do a lot of work to create this nutrition, right? You have to be vigilant.
Yes, you do. Well,
But that's the warrior mentality. You can't trust everything, and you have to be vigilant to
I
survive.
think at the beginning we're vigilant, but then it just becomes fun. I know Penelope and I and you, we're all very creative, and we just get creative and more creative, and it just gets more exciting and more fun, and then you want to share it. But thank you so much for being here.
Thank you.
I've learned so much, and there's so much more I want to learn, and I feel like this is just the beginning.
Yes.
Thank you. Thank you for having me.
Thank
Yes.
you.